control in the near term. Now, for the 3-day RAT testing exercise for the entire community between the 8th and the 10th of April, we would only be able to see the full picture by the 12th of April, because today is the 3rd day. If, say, some people choose to do the test only tonight, and they only report positive cases towards the end of the 24-hour period on the online platform, that it will only be by the 12th of April before we could have a better understanding of the full picture. So we want to see how effective this universal RAT testing exercise is. We have to wait till the 12th of April. And perhaps I could give notice about 3 important anti-epidemic tasks next week. All 3 tasks are important as they give out positive messages to the public. Firstly, there was an announcement earlier that after Easter, all schools could slowly resume face-to-face classes. That means children could go back to school. But of course, there's much preparation for classes to resume. And we have more or less worked out a plan for phased resumption of classes, and whether children have to be vaccinated or they have to do daily RAT tests. Well, we have already formed views on such issues because we've consulted many school heads, schools and electrical members. So in early next week, therefore, we'll be announcing the details of class resumption. And then next week, we'll also be announcing in detail the relaxation of social distancing measures, because we can see, as things are now, we could relax social distancing measures in 3 phases, starting from the 21st of April. And then we said before there has to be a precondition for the relaxation of the measures. First of all, there is no resurgence of the epidemic, and also we see a downward trend for the number of cases. Now, of course, with some relaxing social distance measures, there are many details we have to announce for the relevant sectors. This is, of course, the second positive message. The third positive message is that there are about 6,000 households who should be moving into 3 public housing estates and 2 transitional housing projects. As I announced yesterday, we have looked at the number of confirmed cases in the past few days, so we have an idea of how much isolation facilities you need. So in the coming week, we will review the supply and the occupancy of community isolation facilities. And then we could come to a decision on returning the relevant public housing estates and transition housing projects to the relevant department. So at the 11 a.m. press conference, I will be giving you more details about these 3 aspects with the relevant principal officials. So now the floor is open to questions. If you wish to ask questions, please raise your hands. And when you're called to ask questions, please first identify your organization and use the microphone to ask questions. Thank you.
Start with the lady on the front. Morning, I'm from TVB. For the new COVID cases, we've seen a downward trend in new infections. Does it mean that when case count drops to 3-digit area, and it will be a good time for the compulsory universal testing? Is the Easter holidays a good time for the CUT? If not, we will have another round of mass self-test across the city. Next week, we have the Easter holidays. There may be a risk for a rebound in cases. Will the government be distributing the anti-epidemic service bags for the RAT test? And why? Last question. This is the last day of the mass RAT test, and cases have increased by 300 or so, but we have no idea how many cases have done the RAT test. To what extent does this exercise help us gauge the infection level in the city? There are 3 questions. Some say that our 3-day exercise is a drill or warm-up for the CUT. We have to wait till the 3-day exercise with RET kids conclude, and then we will review the situation. We will consider the development of the COVID situation here, and also have to consider our capacity and the impact on people. Today, we cannot give a concrete answer on whether there's a need for a CUT in the short term. Second, I thank you for pointing this out, that with the holidays around the corner, there will be more people out and about. It's Sunday today. The weather is nice. You can see outside in Tema Park, there are many people. This is understandable. After fighting COVID for 3 months with the social distancing rules, people need to take a breather. But I hope people can stick to the infection prevention protocol, keep a mask on, avoid gathering, avoid close contact with one another. People can do a test with an RET every day. Some groups need to do RET test on a regular basis. First being the people in the care homes for the elderly and those for the disabled. The residents and the staff there have to undergo daily RET tests to protect the elderly. These daily RET tests help identify positive cases. There are 9 levels for PCR tests. There are target groups. There are high exposure risk groups. We also have tests upon entry into Hong Kong. There are also PCR tests upon hospital admission. The PCR test is mostly used in these cases. Now that people are more familiar with RET tests and they know RET tests are also accurate, more frequent use of RET tests might be a possibility. The thing with PCR tests is that people need to book up an appointment at community testing centers and they have to wait for hours before getting the result. So this is something we will consider, possibly more frequent use of RET tests. We will announce something about class resumption, possibly with the RET test. That's a possibility to ensure schools are a safe environment for students. If the students return to school with a negative RET results, that may be a possibility. And as to the point about relaxing social distancing rules, say there's a local tour, if people are asked to do an RET test before boarding a cruise or a coach, then people may be subject to relaxed rules. These are possible scenarios where RET kits can be used. As for the distribution of RET kits, we're happy to provide the kits. Up to April 13th, there are 89 distribution points handing out RET kits. As at last night, we have handed out 360,000 such kits. At these distribution points, people can walk in and grab 4 RET kits, no questions asked, no registration. I encourage those who may see themselves using RET kits more often to get RET kits at the distribution points. If there's a need, we will provide RET kits to those who need them. For example, for people living at the residential care homes for the elderly and disabled, the social welfare department has been providing the kits for use at these facilities. On April 8th, we kickstarted the RT test. For those who declared a positive result and had the results confirmed, there's an increase of 300 odd cases. The downward trend in RT positive cases. But exactly how many fresh cases will be recorded, we will have to wait before we can tell the actual increase. This is a voluntary exercise. Those who test negative do not have to report their result online. So we cannot answer exactly how many people have taken part in the exercise. As I have reiterated, in monitoring the COVID situation, we look at more than just the infection number. Infection numbers are always to look at after people have been infected and declared the infection. There are also other indicators where that can help us stay ahead of the situation. For example, sewage surveillance monitoring. And there are also infection rates monitoring by the HKU. We have to take all these data and indicators into account in assessing whether the fifth wave of outbreak has been tamed. Thank you. Next question. The journalist in white at the back. I'm from Now TV. What do you make of the reported infections? Does it mean there are still many transmission chains who still have more than 1,000 infections every day? Is it a good time to relax social distancing rules? Is there a mechanism or a set of criteria in place so that at a certain point we have to suspend classes? Do students have to do RT tests before going to school every day? What will we do about the students who have been unvaccinated? For the 3-day self-test exercise with RT kit, if people test positive, that is they see 2 lines, they should declare the positive result on the online platform of the Center for Health Protection. There are benefits to declaring the positive result. For Hong Kong, it will help us understand the infection situation in Hong Kong. For those infected, we can also arrange support for those under home isolation or hospitalization for those who need it. For employees, they will get an isolation that carries legal effect. The family members of an infected person will also get a quarantine order, which also carries legal force. These are documents that can serve as proof regarding the need for sick leave under the employment ordinance. Employers will also have to do their part. So this is about the labor right. So I encourage people to report their positive results. We don't have a criteria or an indicator as to the number that counts as a successful exercise. We had thousands. Even if there are thousands or 10,000 cases, we still have the capacity to cope with the situation. In terms of supporting those under home isolation or designated clinics or delivering supplies packs, we have the capacity. The increase in cases on a day or somewhere that we can cope with. Even if there are 10,000 or 20,000 additional cases reported, we can cope with it. And we only had a few hundred reported yesterday. It's hard to set a hard and fast figure on as an indicator. Situation varies with each wave of outbreak. in previous outbreaks, at its peak, we had 149 cases at the peak of that wave of outbreak, and we had stringent measures back then, including postponing the local elections for a year. But coming back to the present, we're dealing with a highly transmissible variant that leads to mild symptoms. We also have the capacity to cope with it. We have isolation facilities. There are more beds available at hospitals. We have people who are vaccinated. If we stick to the 2021 standards and introduce restrictions, that wouldn't be in line with what's needed for public health, and that wouldn't be acceptable. That's why on March 21st, I said this. These social distancing measures have been in place for more than 3 months. If there's no rebound in cases and there's a steady downward trend, that would mean we could start relaxing the restrictions, but we're not relaxing everything right away. We're relaxing the rules in phases over 3 months. For premises under Cap 599F, for some of them, they will reopen only in phase 2 and will remain closed in phase 1. The infection figures now are in line with our overall objective, that is no rebound. The overall infection figures are steady. PCR positive cases have been dropping at around 800 odd cases, and there is a steady decline. This is a time to refine the details about the restriction of the relaxation plans. The same goes for schools. Not allowing students to go to school will have a huge impact on them. It affects not just their studies, but also their psychological, social well-being, especially for the vulnerable groups. They live in cramped spaces. They need space for learning and to interact with other people. In terms of class resumption, we will manage the risks and in letting students go back to school. But what are the steps required? I will announce that with the Secretary of Education in due course.
To my right, on the front row, to the far end, I'm from Cable. Sorry, can you speak up, please? I'm from Cable. Now, Mr. John Lee announced his election declaration with 3 goals. One is outcome-oriented. Now, you are the incumbent chief executive. How do you look at this direction of Mr. John Lee? You also were an administrative officer. You have over 42 years of service in the government. So, would you say that what he's saying means that procedure does not matter so much? And what about the acting appointment for the Chief Secretary for Administration? If the post of the Chief Secretary for Administration remains vacant over an extended period, would it affect your effort in fighting the epidemic? Another question is about the 3-day, the mass voluntary RAT testing exercise over 3 days. From the first day, there are just an increase of over 300 cases is not really substantial. Do you think the public heeding your appeal, or is it true that there are actually fewer infection cases in the community? And then the Secretary for Education said yesterday, the Bureau is looking into the possibility of asking students to do daily RAT before school. So is there a timetable for implementing that measure? If students have to take the test before going to school, is it really practicable? Because as schools say, they may not have enough manpower to check each and every test result. You asked 3 questions. Start from the last question. because the theme of this press conference is anti-epidemic effort. Now, on the 8th of April, we started the first day of the 3-day RAT testing exercise. Some 1,600 cases positive results were reported. And then the day before, there were 1,200 RAT positive cases reported. So it's the increase because of the mass testing exercise. No one would be able to tell. Because without the mass voluntary testing exercise, the number is actually dropping. You can tell from the figures in the past few days. So the increase is probably because someone have heeded the appeal of the SL government. They did an RAT on the 8th of April. They tested positive, and then they reported their cases. It's a possibility, but no one can tell for sure. But then the number is smaller than what we've expected, because before we started the exercise, some warned us that you have to prepare for a sudden surge of over 10,000 cases. Now, this did not happen. Of course, it's a good thing. But then I believe many people have actually heeded our appeal, because on online report or post on my Facebook, and then among our friends and relatives and among different sectors, we see that people are actually heeding the appeal to do the RAT for 3 days. So there is a substantial number of people doing the RAT voluntarily, and then we are not seeing huge increase in the number of additional cases. That should be good signs. That's why yesterday I said it was comforting to see that, and I was happy about this. And then today and tomorrow, there could be positive cases reported too, and maybe that will still reflect the same trend. Now, for students taking RAT before going to school, that's a measure to protect the school and all at school. Now, our position may be different than that of others. Some believe for schools there should be the vaccine pass arrangement. That means for students not vaccinated, they should not be allowed to go to school. But then the position of the government is that we should not decide whether a student should go to school or not on the basis of whether that student is vaccinated or not. Because going back to learn at school is very important for the development of students. It's not like, using the vaccine pass to go for a meal or go to the cinema. Now, if students have to use a vaccine pass to go to school, it's not desirable for them. And we're talking about a huge number here. For the age group between 12 and 19 secondary students, that is, over 90% of them are vaccinated. But then for the age group of between 3 and 11 years old, that is those in kindergarten, primary schools, there are some 200,000 who have not been vaccinated. So because the vaccination rate is only 62%. So does it mean that for these 1/3 of kindergarten primary students, they have to stay home because they are not vaccinated, and then the other peers could go to school? So we have to consider the interests of students, and we have to consider how we could manage the situation properly. How do we make sure that students could go to schools which offer a relatively safe environment? So if students take RAT first, and then if the result is negative, then they can go to schools. Probably it's relatively safe and reliable, because if they test negative, they can't turn positive in just a few hours. But are we going to do the test every day or every other day? Well, we have to consider that, and we'll be making announcements soon. And then, of course, we've announced that schools could resume classes face-to-face classes after Easter. But of course, the resumption has to be done in phases. Shall we start with some primary schools first? Because for secondary schools, they will be the GSE. Perhaps we have to wait for the core subjects examination to be conducted first before students go back to school. Anyway, we'll be announcing the details together with the Secretary for Education next week. Now, of course, with every measure implemented, there will always be challenges, but the challenges should not deter us from taking those measures if these measures are based on public health considerations and if the measure is beneficial, say in this case to the student groups. So we will have to, face up to such challenges. For the Chief Secretary for Administration, so far we have not received any announcement on how we should deal with the vacant Chief Secretary for Administration post. Now, whether it's the usual acting appointment for when a principal official is on leave, or whether it's to go by Article 48, Bracket 5 of the Basic Law, that is, the Central People's Government will make an appointment on the basis of my recommendation. I haven't received any notice yet, but as I said a few days ago, for all the tasks taken up by the Chief Secretary of Administration, they're still going on, and that includes the anti-epidemic tasks. A third point, as I said earlier this week, I am not going to comment on any aspects of the Chief Executive election. That is the election of the sixth Chief Executive. The only thing I would deal with in relation to the election of the sixth Chief Executive is that I have to make sure that the election is on the basis of patriots administering Hong Kong. So that's why the Candidate Eligibility Review Committee will be reviewing the eligibility of candidates. And also, from now till the 8th of May, the polling day, we'll make sure that under the supervision of the Electoral Affairs Commission, the election will be conducted in an open, fair, and lawful manner. Thank you.
We'll take two more questions. Let's start with the Chinese question. The journalist at the back with glasses. At the back. I'm from Mingpao. About the 3-day self-test with RAT, the Center for Health Protection said that there may not be many people heeding the appeal. And based on the 3-day exercise, do students have to do an RAT before they can be allowed to go to school? Is an appropriate basis for making this assessment. Second, the flight suspension mechanisms. The government relaxed the place-specific suspension mechanism, but we don't see an increase in frequency of flights arriving at Hong Kong. Some airlines have suspended flights to our city, and there are arguments that we have lost the status as an aviation hub. Is there anything we can do so that we can be an aviation hub once again? In terms of class resumption and requiring students to do RT tests every morning, if that becomes a requirement, does it mean that we don't have to have the same stringent requirements for class suspension as we had in the past? You had raised three questions, but the first and third are connected. They're both about class resumption and the use of RT kits in that context. I want to point out that I've not heard about the CHP saying that there are not many people heeding the appeal, because no one can say whether there are many people heeding the appeal or not. It's a voluntary exercise. Those who test negative do not have to report their result. No one can tell how many have taken part in the RT exercise on those 3 days. For schools, the class resumption after the Easter holidays is a key objective of our anti-epidemic efforts. Schools have been hit heavily by COVID. There has been on and off class resumption and class suspensions. And students have to do online lessons, and that's not an ideal situation. Because it affects not just the studies for our students. but it also hinders the normal development of students. For those 8, 9 years old, or those in their teenagers, they're in their formative years, but 2 and 3 years in this development, they have been hit by COVID, and they're not sure whether they can resume classes. They don't get to spend time with their peers on projects, sports, etc. That's why I'm working hard with my colleagues at the Education Bureau to resume classes for students. The DSC exams must go ahead, and that's one example. There are school-based assessments, but an exam can mean everything for their future. That's why we have undertaken a lot of preparations for the DSC exam. This is an interdepartmental effort. The Penny's Bay facilities and the COVID taxis are not under the purview of the Education Bureau. There's high-level steer involving various bureaus, departments, to make it possible for students to sit the DSC exam. For the more than 100,000 students, we're doing everything we can to make class resumption possible. I will not go into detail about class resumption because there are details to be threshed out by the Education Bureau. But more frequent use of RT kits is a helpful way. This has been used in care homes for the elderly, for the disabled, and for others at a high risk of exposure to COVID. They have to do regular RT tests. They have to test negative before they can engage in certain activities on certain premises. But Omicron is such a transmissible variant. Someone who tests negative today may not be protected for the next week to come. So we have to consider how frequent people have to take the test. This is something we will be announcing shortly. Our objective is to allow students resume normal school life as soon as possible. So class suspension is not something to be taken lightly. But after the past 2 years, there are risks that are manageable. Omicron comes with mild symptoms. Many have been vaccinated. At schools, most staff, teachers have been vaccinated, except for those with medical reasons. As things have changed, we have to adapt our policies and put students' interest first. The second question was a major question. Hong Kong's status as an aviation hub. I've worked with the Secretary for Transport and Housing and also worked with the Airport Authority to maintain Hong Kong's status as an aviation hub. Apart from taking forward the third runway project, there have also been new reports on the artificial island and also the Sky City project. And other projects related to logistics. We are also in discussion with the Zhuhai Airport about us having a stake in the Zhuhai Airport. The work has been recognized by the central authorities. In March last year, in the 14th Five-Year Plan, there has been a part about supporting Hong Kong in developing into an international aviation hub. We attach importance to efforts on this front. We work hard towards maintaining and strengthening Hong Kong's status as an aviation hub. There are two aspects to it: passenger travel and cargo transportation. The impact on goods has been limited. The same goes for overland travel. Hong Kong does not produce its own goods or food. Ensuring the supply of goods has been a key part of our anti-epidemic work. That's why, in terms of exemptions for overland lorry drivers, there have been exemptions in place. Last year, air cargo has done fairly well last year. In 2021, we actually were at historic highs in terms of the volume of goods and the value of goods arriving or leaving through air. The continuous flow of goods has made this result possible. We ensure the flow of air cargo, but passenger travel is tricky. There are people involved, and people may spread virus. In our strategy of guarding against imported cases, we have to have control over passenger flow. You cannot have too many people arriving at any given time. For cases with serious COVID outbreaks, we had different tiers, tier A, B, C, D, and we had different restrictions. Arrivals had to undergo quarantine at hotels. As said today, we stick to the strategy of guarding against imported cases. The relaxation introduced recently was to lift the place-specific flight suspension mechanism. But the relaxation applies only to Hong Kong residents. Only Hong Kong residents from those 9 places can fly back in. But we are not giving up the strategy of guarding against imported cases. Having this strategy in place will have a certain impact on passenger traffic. But as COVID eases off, we hope we can make some progress on this front.
Yeah, the lady at the front, in blue, yeah.
Good morning, Mrs. Lam. Few questions from SCMP. What is your takeaway as the RAT testing scheme comes to an end? Do you feel that there's anything that can be done better? And earlier you said that there's no estimate on how many people in total took the RAT test during the 3-day scheme. So how can you actually tell that that's going to be the full picture in the next few days? And second of all, you announced relaxation of social distancing measures for the next week. I'm wondering if the full picture of the RAT testing scheme will tie in with next week's announcements. So for example, let's say if there's a sharp increase in RAT cases in the next few days, is there a possibility of these measures being delayed? And my third question is on the Singapore-Hong Kong transit. Currently, travelers are currently not allowed to transit through Singapore's Changi Airport to Hong Kong. Is this a Hong Kong mandated rule or is this a Singapore mandated rule? So with the easing of the flight restrictions, will the Changi Airport transit rule also be addressed? Thank you.
Thank you for the 3 questions. First is the exercise to encourage Hong Kong people to take a rapid antigen test every day for the period of 8th to 10th April is coming to an end today insofar as the taking of a test. But insofar as the announcement of the results, i.e. how many were tested positive as a result of taking the RAT and also reported or declared to the Center for Health Protection has yet to be seen. Because so far, we have only got the figures for the 8th of April, and they were announced together with other positive figures yesterday at a 4:30 press conference by the Center for Health Protection. So it's still too early to tell. But what I can tell you and have been telling you is we will not be able to know how many Hong Kong people have taken the RAT tests as a response to the government's appeal, because one is this is entirely voluntary. They don't even have to register or come forward. And secondly is even having taken the test, we are asking only those tested positive to self-declare so that we could arrange the necessary isolation, home support, and treatment for the positive cases. So we will not be able to tell. So it's not a question of whether we are competent or not. By definition, an exercise of this nature will not be able to come up with a figure on how many Hong Kong residents have taken the test. But anecdotal evidence suggests that many have. We have been asking around. We surf the Facebook of different groups and the social media and so on. But naturally, in a city like Hong Kong, I'm sure there will be people who do not respond to the government's appeal. But what we will know is whether this far more intensive RAT will result in more cases. Actually, before we commence on the 8th of April, many people told us and warned us that you will be seeing a surge in cases. So you better be prepared for all your facilities and support measures and hotlines and so on. And we did. We did make full preparation for a surge in positive cases as a result of the RAT. But as it turned out, the first day figures do not show this surge. Okay? Whether it has given rise to another 300, 400 or not, the total number of RAT tested positive cases reported yesterday, we're only 1,600. So it's well within our capacity to manage. So we'll have to wait and see today, tomorrow, or even Tuesday to know exactly the results, i.e. the total number of RAT tested positive cases taking into account this exercise. Because even without this exercise, there will still be some RAT tested positive cases in a normal day. But I can assure you, in response to your second question, that the relaxation in social distancing measures announced on the 21st of March and will take place on the 21st of April is unlikely to be affected by the RAT. Because by now it is quite clear that we are trending down. So our starting position is not the 8th of April. Our starting position was the 21st of March. On that day, I think we were seeing 20,000 or 30,000. No, 20 or 30,000 cases. So by and large, unless there was an exponential surge, otherwise we would continue to implement the relaxation. But the relaxation will be gradual. It will take 3 stages over 3 months in order to remove most of the social distancing measures that we have put in. But apparently it will have no particular relevance to the RAT exercise. As far as the Singapore Changi Airport, I don't think Hong Kong, as our government, has introduced any measure that will have that impact. Perhaps this is something you should ask the Singapore government. But at the moment, of course, our Singapore was never put as one of the 9 place-specific suspension countries. So we are seeing people arriving from Singapore throughout the whole process. But if it is a non-HKR Singaporean, then I'm sorry, for the time being, we are not allowing non-HKR people to board a flight to come to Hong Kong. Thank you.
That's the end of the press conference today. So we'll see you again tomorrow at the same time. Thank you.